Looks like we've got a good number of people joining. We'll let the incoming stream slow down a little bit, and then we will get started in just a minute. Okay, welcome everyone to the September Child Welfare Community Connection, and thank you for being here today. My name is Tim Gillette. I'm the operations manager for the Child Welfare and Self-Sufficiency programs, and I use he, him pronouns. I'll be facilitating our gathering this morning, and I want to start off by acknowledging how difficult the summer's been with major fires affecting people all across Oregon. Feels like we got a little reprieve here the last couple of weeks from the weather, but here we are back in the heat. I can feel it in my office away from the office here. Many are helping the Oregonians across the state while dealing with potential evacuations of their own homes. So thank you for continuing to show up for each other. Let's hope that the coming months bring cooler temperatures and more rain. I'd like to start by having everyone introduce themselves. April, do you want to go first?
Good afternoon, Oregon partners and community. My name is April Flint Gerner. I am the Child Welfare Director with Oregon Department of Human Services. My pronouns are she, her, hers. Thanks.
Lacey, you want to go next?
Good afternoon, you all. I'm Lacey Andreessen. I use she, her pronouns, and I'm the Deputy Director for the Child Welfare Division of ODHS.
And Molly?
Molly is on bereavement leave.
Oh,
Molly's not here with us today.
my fault. Sorry about that. Lisa, let's have you go next.
Good afternoon, everyone. Lisa Bender, a she, her pronouns, and I am the Assistant Deputy Director for Child Welfare.
And then Alicia.
Good afternoon, Alicia Cox, she, her pronouns, Assistant Deputy Director in Strategy and Innovation. Good to see you all.
All right, thank you. What a great team we've got here today. Let's talk about a few logistical details as people continue to come in. A few standard reminders. Our meeting is being recorded and we've got ASL and captioning available for you. If you'd like to utilize the live captioning, please click on the CC button that is located at the bottom of your screen. And then as you can see, we've got live captioning here. We have live ASL. So it is pinned to the screen, but you can modify the window in Zoom. Also, the Q&A function is available today, and we will get to as many questions as we can at the end of our agenda. Our focus, as always, is on answering the questions that are relevant for a broad community audience. For our agenda today, the executive leadership team will be providing updates on priorities through the end of the year, what you can expect next in the settlement and budget processes, a brief update on legislative updates, and temporary assistance for domestic violence survivors increases. And then we believe we'll have some time for Q&A. With that, let's get started. April, we'll be handing it off to you.
Thanks so much, Tim. Again, April, she, her pronouns. I want to thank you all for joining today. First, I want to kick off this meeting by honoring Kinship Care Awareness Month. We're so grateful for all of the relatives, kith, kin, grandparents, aunts, uncles, and extended family members that support children in our state and nationally. This is such an important part of helping children thrive, and we're focused on increasing kinship care placements for Oregon's children whenever possible. We really appreciate you. Moving into some of our updates, as you, most of you should know, I've been in this position for just over a year formally, and that has given me and the executive leadership team time to think about how we best partner with our community and how we offer the best version of customer service that we can to you all. These community connections have been happening since I started in 2020, just at the start of the pandemic. And we've continued to hold these spaces virtually to give us an opportunity to connect with partners as best we can on a statewide level. These are also a way of staying in touch with you all and hearing what's on your mind and what you're seeing in your communities and what questions we might be able to answer from a statewide lens. Again, we have the Q&A box open, so feel free to add your questions and your comments throughout our time today, and we're going to address as many as we can. Though these meetings are really, really great for updates, I'd love to have a smaller focused meeting and space for community as well. And if you're not attending these kinds of chats locally, or you're not connected to spaces for local level information and opportunities for feedback, my hope that that changes in the near future. We recognize that information that you need and questions that you have are often responded to and addressed best closest to home and with the leadership that are closest to you that represent the department in the communities where you live. I know that the leadership there are just as committed as we are to supporting you and providing a high level of customer service. So we know we've got a lot of work to get there in terms of building out our customer service and community engagement. But I am confident that between engaging locally as well as attending these forums that we can do better. Because we have a blend of partners here from our resource parents, KithKin providers, advocates, again, not everything might be relevant to each and every single one of you, but we're really trying to make this space as inclusive as possible. And you can continue to count on these meetings for fundamental news from Child Welfare's executive leadership team in central office. And again, I want to thank you for continuing to bring your question to these Zoom meetings. One word of note, we've noticed that some community partners are showing up and attending our internal staff chats, and some of our staff are showing up for the community chats. And I really want to encourage, if you are an ODHS employee and you're coming into these community chats, of course you're welcome. But we really want to prioritize that the questions that we are fielding are from community, because there are other venues for staff to hear from us, to ask questions, to get information. So staff, you are prioritized in staff chats, and community are prioritized in the community chats. Also, if you're community and you were unintentionally invited to our staff chats, please delete that invitation and please prioritize coming to this space. The messages, the questions, the format is really intended for your audience, and many of the internal conversations that we're having with staff just are not geared towards community. So forgive us for any misunderstanding there or any confusion about the difference between those two meetings. Moving on to a couple of updates, I wanted to give a high-level overview about what comes next in the Wyatt lawsuit settlement. The last time we were before you, we had not reached a settlement agreement, and there's been lots of news and media that's gone out about the class action lawsuit against ODHS and child welfare, and we really wanted to take this opportunity to update you on what's happened since May. For those of you who may not be aware and familiar with the lawsuit, let me just give you a brief overview. In 2019, Disability Rights Oregon and partners filed a lawsuit known as Wyatt et al. Versus Kotek et al. Now, at the time, it was versus Brown et al. Because at that point in time, our governor's last name was Brown, and now our governor's last name is Kotek. And it was one of the gifts that I got when I took on this job, that my name was included as being a plaintiff in this lawsuit. And I'm absolutely happy to be a part of the team that is working together with partners to transform the system. So this lawsuit was filed on behalf of young people who have experienced foster care to advocate for transformation of the system and meaningful changes to the foster care system. The lawsuit focused on children and young adults who identify as having a disability, on queer and non-binary young people, those that are aging out of our system, and others. And according to that lawsuit, these groups of young people and young adults are most at risk of harm when they enter the foster care system. Other groups who experience challenges in the foster care system and children, including youth and children who are from Black, Latinx, tribal communities, or other communities of color, or come from low-income families, or who live in rural areas where services are less available, also are worried about, what they're going to experience in the foster care system. So children who fall within these groups, and all children in foster care, are also a part of the lawsuit because they are a part of what we call a general class, or a group of people on whose behalf the lawsuit was filed. Now, in May 2024, just after our last community chat, the Oregon Department of Human Services and Disability Rights Oregon agreed on a settlement to improve the safety of children and young adults after they enter foster care. Changes to the foster care system required in the agreement aim to benefit all children and young adults experiencing foster care, regardless of whether these children identify as one of the groups that I talked about earlier. It's all children and young adults experiencing foster care who should experience the outcomes of a transformed system. It's why we're all here. And so part of that settlement agreement, we've committed to improving foster care system in some very specific ways over the next 10 years, including reducing the number of children and young adults who are harmed after they enter foster care, and improving communication with the state courts, attorneys, children and young adults, and their families when those harms occur. Ensuring that children and young adults receive appropriate medical and mental health assessments, and that happens timely. That we're improving the quality of foster care homes and services for children and young adults. That we lower the number of children and young adults who come back into the foster care system. And that we improve how quickly children and young adults get case plans after entering our care. Case plans outline the expectations for parents of the child and other family members and services and referrals that ODHS Child Welfare will provide. It also outlines the contact with parents, contact with children, and preparation of reports to the courts and other service providers, and timelines for each part of that plan. People have a right to get their case plan and to have it done in a timely way, and we are committed to continuing to do better. As a part of the agreement, we also were assigned a national expert in child welfare who's going to come alongside us to ensure that the progress is being made as committed to. But before that work starts, the settlement requires one final step, which has to be approval by the federal judge. To reach this point, the judge asks for input from those that have been affected by the settlement agreement or who will be affected by the settlement agreement. So members in the certified class, those are young people who have experienced the foster care system. So in August, we co-hosted 2 Zoom meetings with the plaintiff, Disability Rights Oregon, for young people who've experienced foster care to give feedback on the settlement agreement. This process ensures that the class members on whose behalf the lawsuit was filed are heard before the judge approves the final settlement agreement. So those 2 Zoom meetings happen. There's been lots of outreach to try to get voices from young people who have experienced a foster care system to give us feedback on the proposed settlement agreement. On September 12th, which is just a week away, Judge Aiken, our federal judge, will hold a fairness hearing in Eugene to review any objections from youth formerly or currently experiencing foster care. And ideally, at that time, the judge will then approve the settlement agreement. Simultaneously, we are preparing for our child welfare expert. We're calling him our court neutral, Kevin Ryan, to begin working with us to assess Oregon's progress towards the areas in the settlement agreement that we committed to, and some other key areas. So this work is going to focus on specific outcome measures agreed to by both sides in the agreement, including maltreatment in care, or children who are harmed in foster care, re-entry into care, so kids coming back into care after they've been reunified with their families, timely completion of case plans, timely mental health and medical assessments and referrals for those services, and the appropriateness and quality of placements. We agree that these are all areas of needed progress. And we are actually excited to really begin the work of digging in with our child welfare expert, neutral, Mr. Ryan, community, our partners, to really figure out how we can continue to make progress on those areas. Mr. Ryan is going to draw on his extensive experience working in other roles in child welfare in cases connected to Texas, Michigan, Oklahoma, to name a few. After that assessment period, Mr. Ryan is going to help to present to the courts what his findings are and make recommendations about what we can do to improve. Again, we're excited about the process. I know that's strange to say about a settlement agreement, but I think I represent the Child Welfare Division. None of us work here to want to see things continue to not work for kids and families. And so to have an opportunity like this to partner to make sure that we are making progress on the things that are most important to families is something that we're all committed to. So by next April, Mr. Ryan will present his initial evaluation and recommendations, and we're not sure how long the overall process will take, but we are looking forward to getting started, and we are sure that it's going to take time, but we're here for the long haul. There's much we don't know, but we are committed to continue to transform our system. With that, I'm going to pass it back to Tim. I know I said a lot of words. I'll come back and say a few more in a little bit as we answer questions. Thanks.
Thank you, April. Next up, we get to hear from Lacey Andreessen, who's going to talk about the Temporary Assistance for Domestic Violence Survivors grant increase.
Thanks, Tim. We received an investment from the legislature we'll be implementing this month, and the investment is to raise the maximum grant amount for temporary assistance for domestic violence survivors. Historically, that grant was a $1,200 one-time payment that could be used within a 90-day period, and we received enough funding to increase that grant to $3,200. The support can be used on a variety of things, such as deposits for rent or utilities, replacing items that had to be left behind, such as clothing or furniture, new locks, security cameras or alarms, or a post office box. Families and pregnant individuals receiving the grant on or after August 11th of this year will have access to the increased grant amount to support their safety and stability. Payments and amounts, if any, are based on the individual safety needs and must align with the safety plan that was created by the individual and their family coach. Individuals can apply for this support by phone, in person, or by submitting an application. And for more information, we're going to drop the link in the chat for you. We also provide confidential domestic violence advocates in most of our self-sufficiency program and child welfare program offices in the counties, and to support with safety planning, resources, and someone to talk to. You can find more information in the link. Thanks, Tim.
Thank you, Lacey. Next up, I get to do a little presentation, giving an update on the agency requested budget and let you know about some of the changes that Governor Kotek implemented as we went through this process. Jessica, do you mind sharing the PowerPoint? All right, looks good on my screen. Hopefully you're all seeing that. I'm going to talk a bit about where we are today and next steps. One really important piece, the way this budget process has been a bit different is through early collaboration and input from the community. We're going to review what's happened in the past 6 months, or in order to review what's happened in the past 6 months, in April, ODHS submitted to the governor's office a preliminary set of POPs, or policy option packages, for the 25-27 biennium. This was the first in the governor's new budget process, and the POPs were refined over the last several months. As we're developing those POPs, we wanted to make sure that we incorporated the ODHS vision, which guides our priorities, and that vision is all who live in Oregon, regardless of race, identity, age, disability, or place, have the needed supports to achieve whole well-being for ourselves, our families, and our communities. Next slide. Our Equity North Star also guides our values specific to inclusivity, equity, service, and well-being. Next slide. And one more. Thank you. For some context, in the past, agencies have drafted their agency request budgets to reflect a broad vision that they've developed for the next biennium. And then the governor's office would come in later and revise those agency requests to fit within the state budget limits. Governor Kotek's approach has been different. And Governor Kotek's development has been that she wants to be involved earlier and collaborate closer between her office and the state agencies. This has resulted in a collection of agency request budgets across state agencies that already align with projected state budget limits. For community partners, this means that your input was incorporated on the front end of the child welfare budgeting process. And looking at the budget, the most recent forecasts that we've gotten from Oregon state economists are projecting a relatively balanced budget for 2025-27 biennium. The expected revenue increases would cover the increased cost of maintaining our current programs, and any new investment proposals would be reserved for advancing the governor's key priorities. Those priorities include housing, behavioral health, and education initiatives. This has meant that the POPs from ODHS and child welfare must stay within a 1% growth limit of our 2023-25 general fund budget. The balanced budget will have substantial space carved out for the governor's strategic priorities, so the focus remains on core needs for agencies rather than new investments. In order to make the best use of the 1% increase, ODHS's POPs are strategically concentrated in 5 agency-wide focal areas: safety, transportation, equity, partnership, and stewardship. For example, safety, investments to enhance worker and client safety and strengthen oversight of facilities serving ODHS clients. Transparency would be funding to increase public reporting on program quality measures. Equity would include investments to improve services for job seekers with disabilities and enable data collection to help eliminate service inequities faced by older adults and people with disabilities. For partnership, that would be resources to strengthen relationships with tribal nations and case management entities and advance service equity at the tribal and local levels. And finally, stewardship would be funding to enhance regulatory and contract oversight, ensuring responsible and effective use of public investments. Our child welfare policy option packages, or POPs, that worked within the 1% requirement focused on contract oversight infrastructure, family first implementation, and expanding our focus program, which is specialized behavioral treatment services. We also have a POP for a path to housing stability for youth aging out of foster care, and that aligns with the governor's housing initiative. Now for my favorite slide, this is our roadmap and where we're going. This timeline shows the new process overview, and you'll see that the governor's budget will be released on December 1st. The agency request budgets will inform but not dictate the governor's recommended budget. The balanced GRB will be strengthened and informed by what agencies put forward. For next steps, you should expect a communication soon from ODHS requesting your input on our agency request budget, as well as the governor's finalized budget over the next couple months. So again, we'll get a survey out in the next few weeks so that you can provide feedback. All right, I believe we are done with the slideshow and we can move into our Q&A. So as a reminder, if you've got questions, we're happy to get those. We do have a few questions to start with already, and then we'll get to as many questions as we can. And we're going to start with some of your pre-submitted questions here. So April, would you like to take the first one? How is ODHS partnering internally and across agencies to improve access to care and decrease temporary lodging?
Thank you so much. I really appreciate this question. This is April again. So one thing to kind of note is that this issue is really, really important to child welfare. We don't ever want to see that children end up in a hotel. That is just not the best place for children to thrive and to grow. We know that by the time young people end up in temporary lodging, that the child serving system has failed them at many, many, many points. We meet regularly as a child welfare agency with many of the partners in our children's system of care advisory council to bring more people to the table with lived experiences. There are folks, judges, partners in public health, legislators, other programs across the state, so that we can really look at the issue from a wider vantage point. Unfortunately, Oregon has had a lot of child serving system challenges. We've got a lack of resources in terms of substance abuse treatment, mental health and behavioral health services in our state. And if those things were available in the world, then many of these young people would have gotten their needs met much, much earlier. And so by the time, again, a young person is experiencing temporary lodging, in some ways, we've missed critical opportunities to make sure that they get access to what they need. Many of you may know that Oregon ranks last in the nation as far as young people who are struggling with their mental illnesses across all aspects of life, not just young people who are experiencing foster care. And so for us, it isn't just about young people in foster care. It's really about advocating for young people across our state to get access to the mental and behavioral health needs, supports that they need, long before a call comes into a hotline, or the minute that there are critical moments in their care where people who love them and care for them are identifying that they're struggling. We need access to appropriate services, and we continue to advocate for that. I do appreciate, Tim, you talked about that we are continuing to advocate with our legislature for investments in programs that are showing a lot of promise at helping to meet mental health and behavioral health needs for young people. And the reason why I connect the two things, those things, mental health and behavioral health services with temporary lodging, is that many folks think that young people experience temporary lodging because there are no foster homes. That is just not the case. Young people who experience temporary lodging are not young people that are appropriate for regular family settings without a lot of support. We have got lots of resource families in this state. That's not the issue. The issue is, do they have the services and supports that are wrapped around that family so that the family can make sure that they can be safe and well cared for. And so I often talk about, do the adults around kids feel confident that they can meet their needs? Well, sometimes you can't do it alone. I don't care who you are. You could be a family that loves a child and wants to care for a child, but if they're struggling with mental health or behavioral health or substance use issues, and you're not getting the support that you need, then you don't feel confident as a parent. And sometimes child welfare doesn't feel confident either, because we may not have access to the things that kids need. And so, we are constantly advocating not just for kids in foster care, but for all kids to have access to a growing need, obviously, for behavioral health, mental health, and substance use treatment services. And we really believe that that's going to put an end to temporary lodging. So obviously, we're talking about really investments in upstream efforts that are going to impact downstream impact of a child serving system that is bigger than foster care and bigger than child welfare. And we know that we've got the support of the governor's office, our workforce, and our partners in the child serving system. We're going to figure this out. And I'm continuing to be hopeful that we are really headed towards and continuing to have the right conversations about how to make it better. Thank you.
Thank you. Next question, Lacey, could you help us out with this one? What is happening with ILP?
Yes. And I think that I have a couple questions in a row, Tim, so I'll take them. So the question specific to the Independent Living Program, ILP, in Multnomah County. In this past fall, 2023, we restructured contracts for independent living providers and went through the request for proposal process on those. And it was inadvertently communicated in some places, in particular Multnomah County, that ILP was ending. And that's not accurate. So we've got about 5 different providers who we're contracting with right now to provide ILP services in Multnomah County. We're also meeting with a couple other interested providers who want to submit some proposals to talk about the cost of potentially serving young adults who have more complex needs. So lots of work is happening in Multnomah County to serve children transitioning to adulthood. The next question relates in part to temporary lodging. The question is, are there any updates on our implementation of the recommendation in Dr. Marty Beyer's report? Dr. Beyer was assigned in the AR settlement agreement for the use of temporary lodging by the federal judge overseeing that settlement agreement. And Dr. Beyer was charged with assessing where child welfare is and making recommendations to the judge about what else child welfare could be doing to end temporary lodging. And after completing that assessment, what Dr. Beyer actually said in her report is that there's really nothing that child welfare alone can do to end the use of temporary lodging in Oregon. Of the 15 recommendations she made, 3 of them are things that we can in part do. And I'll give you a little update on what that looks like. So the first one is around the guarantee of placement stability. Throughout her report, Dr. Beyer talked a lot about the impact of instability in placement specifically on the mental and behavioral health needs of children and young adults who experience foster care. And of course, that makes perfect sense when a child or young adult has to move repeatedly, in particular, if they're being moved to settings where they don't know anyone, it's going to continue to impact their trauma and potentially the way that they're responding to their trauma. So, her charge was to really look at where we can stabilize placement, where we can start early in our work with the child if they are struggling in foster care, to ring an alarm, if you will, and make sure that the children, that the team is wrapping around them in conjunction with the team of community providers who may be serving that young person. So our foster care program manager is leading coordination right now. She and Dr. Beyer have met with multiple local teams and are putting together a plan to look at potentially region-specific infrastructure to build more capacity around placement stability. The second recommendation that we in part have some connection to is her recommendation around intensive in-home support. You just heard Tim talk about where we're looking to ask for investment from the legislature. And this, we call it FOCUS. It incorporates 2 different kinds of in-home, very responsive supports to resource parent homes, to relatives, or at a parent's home. One is the Response and Support Network, and the other is the child-specific caregiver supports. What we're hearing, both from our staff and from parents and families serving children in this state, is when they can get quick, responsive support immediately, it helps again with that placement stabilization. So we Child Welfare have created 2 different types of that and are hoping to continue to get investment to be able to expand that. And then the 4th recommendation she makes in the report is specific to very, very small residential type settings for children, so that they don't have to be in a milieu where that may actually complicate their response to treatment. And we currently have a request for application out on Oregon Buys. We're going to drop the link in the chat for you so you can take a look at it. We are asking for CCAs in the state to give us proposals around what it would look like to serve one child in a home-like setting with expertise embedded based on the youth's need. It's been open since early 2023, and we've had 2 applications so far. They're being reviewed by a committee right now, but they haven't been moved forward to contract negotiation. So really thinking about kind of changing rather than moving children to the services they need, getting services to the children where they are and getting them to them in really small milieu settings to really speed up the rate that they can respond to that treatment. In addition to those, there's a lot of recommendations about the child serving system in the state, including education, local county mental health, a whole variety of things. And so the System of Care Advisory Council is really partnering with us in considering how our state can implement the recommendations of Dr. Beyer. The last question that I'm going to address, and then I'll hand it back to Tim. Can we provide an update on the BRS rate increase that was mandated through legislation? BRS stands for Behavioral Rehabilitative Services. They are child welfare contracted providers who serve children and young adults with complex needs. And they were updated in the last session through a methodology that we recommended in partnership with those providers. And it was approved and funded by the legislature and will continue to be assessed on a biannual basis. So now, instead of having to continuing to come back and us having to go and ask again for like cost of living increases, for example, for BRS, they're built in, that's built into the methodology. So they'll get an increase in each biennium that's in cadence with the cost of living and the cost of inflation. I'll hand that back to you, Tim.
Thank you, Lacey, for that. April, I think the next one's for you. What are your current recruitment and retention approaches given the issues with temporary lodging?
Thank you. This is April again. I want to answer this question in two ways. One, I want to talk about current recruitment and retention approaches of resource families. And then I want to talk a little bit about how that for us is not necessarily connected to temporary lodging. So in terms of the retention and recruitment of resource parents, we have resource family champions is what we call them, that help to facilitate and lead a lot of work in each one of our districts. We also partner with district staff, resource families, and then our partners from the contingent Every Child and other foster care agencies to promote recruitment. And we get most of our inquiries through that partnership with the contingent. We really appreciate that partnership. And then in addition, we are nearing the completion of a 5-module training titled Using Customer Service Concepts to Enhance Resource Family Retention and Recruitment that is available for all child welfare staff. At the same time, I do want to talk a little bit about retention and recruitment and temporary lodging. I think some people falsely connect temporary lodging or the numbers of children experiencing temporary lodging as a sign that we don't have enough resource families. And that is just not the case. What's missing for children who are experiencing temporary lodging is not necessarily a foster home to lay their head. That's not what's happening. What's usually happening again is for children who need a higher level of care, so where a foster family is not the appropriate place for them to live right now. What's missing is a placement availability in the right kind of setting with the right behavioral and mental health supports for them. Again, so we're talking about our recruitment and retention efforts are about families that can provide foster care supports and resource care for the majority of young people that experience foster care. There's a very small number comparatively every year to the number of foster children that experience foster care in any given year. The vast majority of them are placed in a family setting. They are with their relatives. They are in a resource home with certified resource families. And a very small number of young people who experience temporary lodging each year. It is not because there is an availability of homes. It's really more about what I answered in the first question. It's the lack of those behavioral and mental health supportive services and appropriate placements for young people who have trauma-based and behavioral needs that can't be met in a traditional foster home. Also, just a couple of words about, just kind of tying to what Lacey was talking about a minute ago, increases to BRS rates, help to make sure that we have BRS services that can help to meet the needs of young people. The response support network and our child-specific caregiver supports, again, are 2 examples of programs that we're seeing a lot of promise with that also then help to support the individual needs of children who might be at risk of temporary lodging. Thank you.
Okay, Lisa, I believe the next question is for you. What innovations from around the state are helping to keep children out of the foster care system related to family preservation?
Yes, thanks for the question. So we have been working on this family preservation pilot now for almost 2 years, about a year and a half. We started with several sites and then expanded with a second cohort of sites. I don't know if I'm frozen or the interpreter is frozen. Can
He's
y'all hear me?
also, yeah, he's frozen on my screen as well.
Okay.
Maybe
Good. I
Sandy,
was just making sure it wasn't my
maybe-
internet.
yeah, if we can switch back to Sandy, that'd be great.
Perfect. I see Sandy on. Can we pin her? There we go. Thank you. We're seeing some great examples out of Klamath, our District 11, and also out of Multnomah County, which is District 2. They actually have 2 sites now working on family preservation, the Gresham branch as well as the Alberta branch. It's a big part of why Oregon caught the attention of the Doris Duke Foundation, which led to the Opt-in for Families grant funding that we received this year. What we have been noticing is that it's effective to work with families early on who may be experiencing a challenging time. For example, folks experiencing poverty, illness, or domestic violence. By providing economic supports and resources and disconnecting what is poverty and what is neglect, we can address economic issues that often end up leading to neglect. This approach is very different, and a lot of it has to do with the way child welfare shows up with families as a support rather than as a policer of families. So what does that mean in reality? It means identifying families who need support, who may be working with self-sufficiency programs and thinking about more collaboration based on resources that these families need. So for an example, trying to remove the barriers between self-sufficiency programs and child welfare is important because in many cases, we want to work with families before a child welfare intervention is necessary. The collaborations between child welfare, SSP, and others are vital to making family preservation successful. Some examples include our self-sufficiency program and child welfare, working with tribal family coaches working together to provide some quick data in District 2. Again, I mentioned that's Multnomah County. We're already seeing the benefit of this approach. So the number of children in care decreased by more than 50% in Multnomah County in the last 5 years, from almost 2,000 children who were in the foster care system out of Multnomah County down to 823. So really impressive to see that children are not being served in foster care, but rather being served in their homes and keeping their families intact. Speaking of families, relative and family resource placement options for children has increased in District 2 by 74%. Again, as we top this hour off with it being Kinship Care Month, and it's a great increase. We continue to want to see it higher. Multnomah County also has had a 94% success rate of preventing removal when those family preservation services are provided. And they're now serving 14% more children at home than prior to their family preservation work. In District 11 in Klamath County, they've tailored approaches, for example, working with schools on truancy as an indicator of family need for supports. And we anticipate every district will eventually implement family preservation, though they may do it a bit differently based off of the needs of their particular community. Klamath's program in particular has been very effective. Since 2017, they've also seen a 72% drop in the number of tribal children in the foster care system. So definitely exciting work that's happening that we want to keep expanding across the state. I'll turn it back to you, Tim.
Perfect. Thank you, Lisa. Lacey, I believe you've got 2 more questions that you're going to answer before we wrap this up.
I do. There's 2 things in the chat I wanted to just respond to verbally. Thanks, Tim. One is a note to us that this appears to be written by a resource parent. When young people are placed in their home, they're not aware of the changes that came about from Senate Bill 556. And so the ask is there a way to address information so that children and young adults can know about it? And I'm just going to take that as a to-do to take back to the team. I think that's a great suggestion, an important point, and we'll work on some communication strategies. And the second was a suggestion around building out potentially opportunities for employment experience as young people are transitioning into adulthood. I'm always interested in looking how we can better support that very important population. And so just wanted to note that we'll take that back as a next step as well.
Okay, thank you very much, Lacey. I think that wraps up our Q&A section. I want to thank everyone for attending today and for providing us with great questions. April, do you have any closing comments you'd like to provide?
Well, I always have things to say. I always use a lot of words. People who know me know that. I wanted to take an opportunity before we end today to just remind folks again that in this statewide chat and opportunity, the goal really is to provide you all with some communication, some information about what we're managing in central office. If you have questions about visiting your children, or concerns with your certification worker, or things that are coming up locally, if a young person, you're worried about their safety, right? Your best bet, if you are worried about the safety of a child, is to call the Oregon Child Abuse Hotline. That is going to get you the quickest kind of response around those concerns. If you are worried about something that's very specific to your case, we are just so far removed from individual cases that you're going to get your needs met best by the local branch that you are working with. And so if you are a young person, it's your caseworker. If you're a parent, it's your caseworker. A relative, it's your caseworker. If you're not getting responses from your caseworker, it's their supervisor. If you're not getting responses from the supervisor, it's their program manager, a district manager. There's many layers of leadership at the local level who really have to be the first place that you go to get your local needs met around a case. Because if you put it in a chat here, guess who I'm reaching out to, right? I'm reaching right out to that district manager, that program manager, that supervisor, that caseworker, to make sure that they're going to get in contact with you. Again, the other thing that I wanted to just remind folks is that because this is really a space for us to give information from that statewide lens, we often are going to give a statewide response. And so sometimes that may feel like we're being dismissive of your individual kind of concerns, and that's not the intent. We're not in the day-to-day work sometimes, right? And we really are looking at themes across the state. So we are really looking at ways that we can bridge the gap between the local feedback that you're giving, at the local level, the central office feedback that you're giving. So we're trying to create some communication pathways so it doesn't really matter where you give the feedback, but we don't have all of those systems in place yet. But stay tuned. Again, I'm really looking forward to seeing in this next year if we can't see more of these community chats and opportunities opening up in the local areas and districts, and so that no matter where you share your information, it can get to the right place. For today and right now, for everything I know, the best place for case-specific feedback, input, and concerns, again, is at that local level. I also, there are places on our website that we can continue to use for input, suggestions, ideas. No idea is too big or small, and all voices are welcome. We just want to make sure that we get to you and that we respond to your needs in the best way that we can, given where we are right now. So I appreciate that. I also, one of the things I forgot to mention, and since I have a few minutes, I'm going to take the opportunity. It's one of the benefits of being the child welfare director. We also have a foster care ombuds person. The official title is ombudsman. she is brand new in her role. Her name is Alexis Amarelli, and she is a person with lived experience, a person who's worked in our system. She is a great, great partner. She is absolutely someone that you can reach out to if you can't resolve your issue, or, at the local level, or if you have concerns about, your treatment, or concerns about issues, particularly if you're a young person that's experiencing the foster care system. We're going to put Alexis's email in the chat, and I hope Alexis isn't mad at me about that, but we want to make sure that that you all know that there is a foster care ombuds person that you all can reach out to. Also, I wanted to just highlight and remind folks about our statewide respite program. When the question came in about what are we doing to retain resource families, I know as a parent, I needed a break sometimes, and our resource parents need breaks. And so our statewide respite program has been expanded to support families of origin as well, with in-home child welfare services. And so whether you're a resource family or you are a family who is being served with your children in your home, there's opportunities to get a break. And so we think that respite is an important part of retaining resource families, but it's also an important part of just being a system of care around children and their families. So just wanted to highlight that placement stability happens when sometimes folks who are tired and needing help get a break. With that, I just wanted to thank all of you for coming. Thanks for continuing to show up and for giving us a chance to keep trying to do better about increasing communication and in collaboration with you as community. Again, leverage your local channels. Leverage our foster care ombuds office, keep sending emails to the child welfare director email inbox, and please, please, please keep showing up for these chats, particularly if you are community, come to the community chat. If you're staff, come to the all staff chat, and we're just going to keep working on it together. We really appreciate you all coming. Take care.